distinguished speaker series, Opportunity Ohio. We are partnering today with the Liberty Foundation of America. Michael Carnuccio has joined us all the way from the Sooner State, which my son, who has S's for Sooner, likes that book. Sponsors, want to thank our sponsors, Provision Strategies, Bottom Line CPA, many of you know Bill Jacob. Bill Jacob is a good friend of ours and we continue to love his work. And Ohio Rising, Chris Hilton, who many of you know Chris as well. So today's conversation is about the idea of competitive federalism. It is an issue that I feel is one of the biggest issues that we need to be discussing as a nation. I think if we are going to kind of unring the bell of a growing federal burden, a growing federal debt deficit, control over our lives, we've got to, as a nation, stand up from the grassroots, from the states, and say, where do we want the locus of power over our lives? Do we want it in Washington, or do we want it in state capitals, town halls, school boards, and the places where we have control? And you know, in Ohio, we just spent the last few months having a very vigorous debate over expanding Medicaid under Obamacare. And I think that's a wonderful example of a situation where there is a state role, we can actually have a say and our voices can be heard. But even then, it is still inherently a federal program that is dictated out of Washington. So ultimately, as you'll see in the report, which we'll talk about in a minute, we get to this issue of how do we get power out of Washington, money out of Washington, so that our states have more power and money to solve our problems in a way that we have competition among the states, like we did in some capacity for welfare reform, education reform in the 90s, where we get better goods and services at a lower cost that balances the needs of those programs with taxpayers' ability to pay. It's a very important issue for us as we go forward as a country, as a state, and as communities across the country. I want to welcome Michael Carnuccio. Michael is a peer of mine out of Oklahoma. He does what I do in Oklahoma, but he does it way better and way more effectively than I can do it. He'll tell you a little bit about the Liberty Foundation, which is a group that just started about 2 months ago, less than 2 months ago, and some of the things that we're working on. So with that, I'm going to hand it over to Michael to talk a little bit about the Liberty Foundation, some of the work we're doing, and then we'll get into the report more deeply, and then try to spend most of our time doing Q&A for anybody who has questions about this issue of competitive federalism and how do we make it work. So with that, I'll hand it over to Michael.
Okay, thank you, Matt. And thank you all for having me. I will make the disclaimer at the beginning here as I'm sitting that, as you know from my last name, the Italian part of me, I will do air traffic control signals, and it may just be halfway through the conversation I might have to get up and stroll around. So this is a true privilege for me. I really appreciate the opportunity. I want to compliment you on the turnout and your participation in this conversation. That's the foundation of this country, and that's the beauty of it. And if there's any challenges, the way we're going to solve those and start is by you and I working together in this kind of a forum, this kind of dialogue. So thank you so much for spending time with us today. The Liberty Foundation, as Matt said, was an idea that a couple of us had and Matt and I kind of ran with. Essentially, there is at least one free market think tank in every state in the country. Some states obviously have two, as you all know. And some states are, actually one state has 3 now. So there's just over 60. In fact, by the end of this year, probably 65. We all belong to the State Policy Network, which is the trade association for all the free market think tanks. But one of the things we noticed was that there are certain times where key public policy conversations that can help improve a state and create that competitive marketplace. It may happen in Michigan that's going for right to work, and the impact of that will help so many other states, right? So why don't Matt and I spend our time, or some of our time, helping them out, helping our friends, so we can advance kind of the state movement and put more pressure on the federal government. And so we created the Liberty Foundation of America. It was constituted out of a group that existed from Oklahoma. It is a national organization. Former president of the Heritage Foundation, Ed Fulner, is one of our founding trustees of this organization. So you can see the national scope that it has. But basically it's on the idea that we can leverage the assets that exist in the free market movement to help advance this type of public policy dialogue and help realize states' ability and power and citizens' ability to get involved in the process. So we'll dovetail from there into this concept of competitive federalism. Matt was the author of the report, so I'm going to ask him to talk a little bit more in detail about it. But from the Liberty Foundation, what our perspective is simply you can make a better decision with your tax dollars and with your local representatives that you have a relationship with than some folks far away in another state? And why should other states that are making bad decisions be able to profit off of your tax dollars that are funneled through the federal government, rather than you be able to utilize those resources here? So in order to have that conversation, we step back and we ask, well, what happens with the resources that go to the federal government? How much is that's collected, and what is the administrative burden that's paid? How much of our tax dollars is just feeding the beast in Washington and not doing anything in terms of a service or a community good or anything else, no matter what we particularly would feel about that particular service or a project of government? How much of it is just feeding the beast? And then let's roll it back from there. And I'll wrap up here the opening comments just by calling your attention. Well, I guess we're sending the report out to everyone, correct?
Yeah, so everyone here, it's also why I want you to register, is I'll send you a PDF copy of the report that you can then read at your leisure online, at your computers, whenever you have time to look at it.
One of the things that you'll see here in the very back is we break down by every state the total amount of tax revenue that went into the federal treasury. That's a little over $2.3 trillion. And then we take education, transportation, and Medicaid, 3 programs that the states are administering, and a lot of times they're administered at the local level. And we ask that question, well, what is the administrative burden of those resources? And out of that money that went into the federal treasury, how much came back here, say, to the state of Ohio? And that helps to guide conversations. And one of the things we found is that typically you have low-end 15%, but on average about a 35% administrative burden just to feed the beast in Washington. So your dollar that is going there and then coming back here for you to do something is coming back at 65 cents on the dollar typically. Out of that, if you just took the 15%, watch this, the 15%, best case scenario administrative burden, for those 3 programs that totaled a little over $564 billion, 15% of that is $85.6 billion. That's the number that they're trying to figure out what to do in sequestration right now in Washington, that they're just running in circles. So if we just follow the Constitution, we've solved the problem overnight. And so this is a dialogue about not only why and how we could put states in more control, but it's the best case scenario in the first place, and highlighting that and having that discussion. And Matt, I might kick it to you here and ask you to kind of dive in a little bit more into the report and some of that detail, and then we'll get ready for some questions.
So thank you. The whole concept of competitive federalism is really to say, look, if you look at the structure of the Constitution and you read the Federalist Papers, which is what we have as the strongest indication of what the Founding Fathers intended in the words that are in the Constitution, and you can also read the Anti-Federalist as well, because they had some insights as well. It is clear by the statements they made in the structure of the Constitution, 9th and 10th Amendment, that the locus of power over our lives was supposed to be the states and should be the states for the vast majority of kind of our day-to-day existence. And what has arisen over the last 80 years is frankly the exact opposite, where every day more and more of what occurs in our life from the moment we wake up to the moment we put our heads back on our pillow has a federal tie-in. And even while we're sleeping, there's things going on that impact our lives as well coming out of Washington. And so if you just go back to the root base of the Constitution, that's what our Founding Fathers wanted. And why did they want that? They wanted that because, as we submitted this report, they expected to have these laboratories of competition. I know there's the term laboratories of democracy gets thrown around a lot. That came from a dissent in a Supreme Court case from Justice Brandeis, which actually he was intending it the opposite way we use it on the right. So that's why I like to use laboratories of competition. Because that's really what they expected is, once they had, where states couldn't do tariffs and taxes arbitrarily against each other, they really wanted this robustness of policy that states would compete to try to attract the best and brightest and have these industries arise, and instead would have great might and power in their states and make their states great. And that's what occurred for the first 160 years of our nation. And then really, as many of you know, in the 1930s, with the rise of the progressive state, with the increased administrative state that came out of the New Deal, the Great Society, we erected more and more of these entities that essentially became all-powerful over our lives, where state legislatures and governors have lost a lot of power, and some of that they've given up where they shouldn't have. They've gotten used to putting their hand out rather than their hand up. And so our thought process is, we're looking at a federal government that is fiscally broke. I mean, it truly is in increasing deficit spending every year, increasing the debt on our country, our kids, grandkids, and there is coming a crunch point. And so how are we going to unwind this? How do we step back from this fiscal cliff to say, wait, what's a smarter way we can do this? And that's really where these laboratories of competition and competitive federalism can play a role. Because, as Michael was noting, 15 cents to 35 cents of every dollar goes to bureaucracy, waste, fraud, and abuse. Right? Program after program goes up and down, depends on the various programs. But that is money that the dollar we send to Washington is used grossly inefficiently. And so our view is, why would we not want to shift the locus of power from Washington back into our states where, no matter if it's a Democrat governor or Democrat legislature, Republican or mixed, split party, we don't care. Our view is we'd rather have those fights in our state capitals where we have more transparency, more accountability, more ability to actually impact what happens. And I think there's no better example of that than Medicaid expansion, than the severance tax, where a very small group of folks, and I know the media loves to say that this is somehow some Koch brothers funded opposition to Medicaid expansion, but I don't know of anybody who's received any of those funds. This is really just a small group of people who said, we're not going to tolerate this or accept this, and then a huge amount of grassroots work done by folks like you to say, sorry, we're not expanding Medicaid, it doesn't give good outcomes for people in the system, and it's going to bankrupt Ohio from a state standpoint, let alone federally. So why continue in a program that doesn't make sense? And in fact, we co-partnered with the Liberty Foundation, Opportunity Ohio did, to commission a Medicaid survey of Ohioans, and it was clear Republican primary voters, independent voters overwhelmingly believe expanding a program where there's waste, fraud, and abuse, and where there's gross uncertainty on the number of people that are going to show up and how much they're going to cost is simply not a prudent, fiscally responsible decision to make. And so we're grateful that the Ohio House took the decision to keep that out of the budget as proposed by the governor, and we hope the Senate follows that lead, and we have a budget at the end of June that does not include Medicaid expansion. We did the same exercise in Florida. We helped that legislature by helping do a survey down there of Floridians. We did the same thing in Arkansas, and we did the same thing this past week in Michigan, where we're there now into the same discussion. And what we're finding is, state after state, the outcome is the same. The middle and the right do not support expanding Medicaid, given the amount of waste, fraud, and abuse that's in the system and the uncertainty behind the program. Huge numbers of folks. And so that says, why would you possibly ignore 2/3 of your citizens because you have a vocal third as well as entrenched interests like hospital lobbies that are going to push for these things when there's just simply not the support. The bigger move, though, is for us to change the dialogue to a broader dialogue, a harder dialogue, a longer dialogue, which is to say, and this is what Liberty Foundation has decided to undertake, is to say we need to start having conversations in places like Ohio and all the other states about competitive federalism, about saying, why do we simply accept and acquiesce to federal power and federal taxation to the degree we do, rather than saying, let's start at the grassroots by educating citizens, by sitting down with state legislators, which we did earlier today, by sitting down with statewide elected officials, which we're doing later on today, and saying, explaining why this is important to them. Because again, Republican, Democrat, it doesn't matter. Every governor and every legislator is going to want to have more power and money. And our view is that $564 billion, the federal government, we should cut taxes by that amount federally so that states can raise taxes. But because we're cutting out that 15 to 35 cents of every dollar that's waste, fraud, abuse, or bureaucracy, the federal tax decrease will be greater than the state tax increase to directly fund these programs. And we'll be able to design programs here in Ohio ourselves and figure out and balance the burden of vulnerable populations with taxpayers' ability to pay. We can focus on getting better outcomes that aren't controlled by Washington, but that we can control here. We can work closely with our hospital associations, with our service providers, to design a state Medicaid program. And guess what? The 49 other states can too. And the beauty of our system is that laboratory of competition will give us what works, what doesn't. It'll allow people like Moonbeam, or is it Moon Brown? What's Jerry Brown? Moondance? Whatever his name is. But if Moonbeam wants to have a Medicaid program funded at 140% of the poverty rate, great, let them. But let's make sure that Californians are paying 100% of that cost, not Ohioans through federal taxes subsidizing bad decisions going on in California. Because here's what happens, right? If Moonbeam does that, he'll have to raise state taxes to a point where he'll chase more businesses and people to Texas or Ohio, and they'll shut down the Silicon Valley because they're going to open up the Ohio Valley because we're going to do it smarter than they are. And they will be forced to reform. And guess what? Those reforms will help all boats rise, so that way states that do it poorly will have to figure it out. You know, we're seeing this right now with workplace freedom, right? Michigan went workplace freedom last year, and so did Indiana. Ohio remains a state that is forced unionization, and right now there's no political will to change that. Well, the reality is, every week we're losing companies to Indiana and Toledo, right? In the same week that the governor was down in Cincinnati making fun of Indiana because it doesn't have as many big cities as Ohio, that very same week, the Indiana Economic Development Commission was sending out a press release about another Toledo company going across the border to Indiana because they don't want to have a pro-union state. They would rather have a state where they have the flexibility to control their workforce and to do what they need to do to stay competitive in a global environment. And so that competition by Indiana in Michigan is going to force Ohio to change, because if we don't change, we're going to have the same amount of job growth we've had since June of last year. Remember, most folks don't realize this. Last year, Ohio's private sector had the 39th best job growth. We added a whopping 42,000 jobs in the entire state in our private sector last year. From June to last month, Ohio has netted 3,700 private sector jobs. I kid you not. Go look at the Bureau of Labor Statistics. Folks, that's not going to cut it for our young folks, our best or brightest. But that competition from Indiana and Michigan will force the political will to get the change done. And that, we believe, can happen on Medicaid, on transportation, on education, because fundamentally, we don't need Washington to tell us how to take care of our sick, educate our kids, figure out which roads and bridges need to be maintained, expanded, shut down. And that applies issue after issue. So we believe, as we start this national dialogue, as we get more and more state legislators, statewide elected officials, citizens on board, and it's going to take time. We've got invitations to hit another 20 plus states over the next year, and we're going to go out there and have this same kind of conversation. But as we get more and more folks pledged to this greater vision, this greater idea of what America can be again, we will then say to Washington, to our congressional delegations, time for you to support this too. John Boehner, where's the legislation to do this? Pat Tiberi, where's the legislation to do this? Rob Portman, Sherrod Brown, where's the legislation? Because we don't care who the governor is and who controls the legislature. We'll fight the fights there, and we'll make the right decisions, the best decision for Ohioans at the right level. So that's fundamentally what we're talking about with competitive federalism, and why we think this is the most important conversation we can have. Because every other issue we talk about really comes down to, is Washington going to tell us what to do? Are we going to have some control over our lives? Fundamentally, if you think about issue after issue, that's where it comes down.
Yeah, and as we segue in and start thinking of some of your questions, I think we have a mic that'll go around. Let me give you two more examples of how this plays out, especially in terms of the competition model between states. Oklahoma, we're in the middle of what's the Wall Street Journal last year called the Heartland Tax Rebellion. And so what we saw was a governor that was elected in 2010, Mary Fallin, about 78% approval rating at the time, and her state of the state said, I want to put Oklahoma on a path to phase out our income tax. I'm tired of Texas taking all of our jobs. We've got to be more competitive. Because Oklahoma in 2001 became a right-to-work state. Oklahoma has done a couple of reforms, but yet we're still seeing 70% of the U.S. private sector growth during the recession was in the state of Texas. And when you're on the border and your football teams hit each other, that gets on your nerves. So she kicked it off, and Sam Brownback said, I'll see you and I'll raise you one. I'll actually get something major done. And what's happened now is the state of Kansas, not only did they lower their income tax rate, but they zeroed out the income tax on small business. If you have an S Corp LLC, it's zero now in the state of Kansas. So in Oklahoma, small business pays no income tax north and south of our border. Well, they just ran an ad. It's running actually in Kansas City right now as we speak, where State Line Road that divides that city between the two states. They have a panoramic view, and this 30-second ad shows over about a 2-month span of time, you see businesses that closed on one side of the street and opened on the other side of the street around the 1st of this year, because they went from paying 6% income tax to 0. So guess what Missouri is doing right now in their legislature? They're trying to cut their taxes. So guess what Oklahoma is doing right now? It's this competitive model. And who wins in that scenario? The people, the entrepreneurs. That is the type of system we can have. The reverse of that is there are healthcare challenges in a healthcare system that everyone seems to agree needs to have some sort of fix, and there are solutions on all sorts. So Washington takes on the problem, creates a behemoth, creates a structure that's going to bankrupt the entire country, put people out of business. It's going to provide worse health outcomes. That's the opposite model. But what the beauty is in all of this, and we had this conversation with the lawmakers this morning, so many of the federalism conversations hinge upon Washington taking action, convincing Washington to do an amendment of some sort or to work with the Constitution. The beauty of competitive federalism and the beauty of empowering states, when the Patient Protection and Affordable Care Act was passed, it was contingent upon every state adopting the state-based exchange, the state setting up the apparatus, and then the Medicaid expansion being part of increasing those pools and bringing everybody in. So now that you've had, what, 2 dozen, close to 2 dozen states, actually when you stretch it, you almost have 3 dozen states that have either said no to the exchange, no to Medicaid expansion, or some both, like we did in Oklahoma. And what Washington is realizing now is the legs are cut out from under that system. It doesn't work. If the states don't comply, it won't work. And so now you see HHS scrambling, trying to cut deals. So the point of this is, if you start empowering states to have, say, education reform, and states start taking over their education policy, and you're going to do it differently in Ohio than Bobby Jindal's going to do in Louisiana, than we're going to do in Oklahoma. But we're going to start creating that competitive marketplace where the children are the ones that benefit. The future workforce, the parents are more empowered and they end up benefiting, the taxpayers. That in and of itself is going to put pressure on Washington. And so I think you can be confident that Liberty Foundation, as we continue to go across the country and work with these other groups, you're going to start hearing about more of these discussions. You're going to start seeing more of the battles like we've seen in the past few years and making sure that we finish those last 3 feet. But remember, the taxpayers and the citizens win in that scenario, and that's what we're after. Do we want to open up for questions, maybe? Or?
Yeah, so question, I think Mary and Chris have mics, and they'll ask questions. And one other thing I want to add, and you got this piece in your handout, these are the logos of 30 groups across America in 29 states that endorse this idea. So this has legs. This
it's on the back page of the media recap.
But this, what this shows you is, this is the largest partnership from the state level, one of the largest in the history of the United States, getting behind this idea. So this is something that we're going to push forward, because as Chris said, and Obamacare is a great example. When Washington drives the bus and they make a mistake, 305 million Americans suffer. If Ohio makes a mistake, 11.5 million suffer. And those states around them that don't make the same mistake force us to reform. That's why this works. Competition is what has made America great, and it will again if we simply unleash the power of competition to bring America to the top, that race to the top. It's not a race to the bottom. Competition has never been about who can be the slowest. It's about who can be the fastest. And we will win if we get competition back into our system, as our founding fathers in the Constitution embedded that idea. So with that, we're happy to take questions.
This sounds a lot like what Gingrich was talking about in 1994 with devolution. Okay? Is this substantially different? Or what is the approach going to be? Because that obviously didn't catch on and succeed. What do we need to do differently now? I don't want to be here in 2034, retired, saying, shit, we should have done this 20 years ago. We're saying it now. Okay? So, anyways, if you can answer that.
I think, and Matt, you might dive specifically, but my key point would be, the key difference is that was a Washington-driven reform. Washington, even though it talked about the states, it was Washington setting the standards and directing how you would have state empowerment on welfare reform or anything else, but it was Washington model. And Republicans or Democrats, I mean, it's the power corrupts, right? And so as much as it's a good idea and I want to do my idea, the power base in Washington does not want to relieve the power. I mean, we see this with some of the groups that we'll even work with at a national level, where the idea of completely empowering states and reducing the importance of Washington scares some of them.
Yeah. They'd rather do a block program than say, let's adopt this model. They're saying, no, we should do a block program. And inherently our view is, well, that still has Washington in charge of how much you get and who's eligible. Why would we do that? Right? But that's a great question on Newt Gingrich and the Republican Revolution. We talked about that briefly in the report. And Michael's exactly right. That was a Washington-driven process. And that's why we are not spending our time in Washington talking to congressional delegation members yet. Our view is we're going to start at the grassroots and we're going to create a fire that burns across the plains, right? And creates that movement that then we go to Washington saying, either you do this or, right, we'll get people in there who will. And that's fundamentally the difference between that approach. And here's why. Did anybody ever read the book Naked Emperors? Very obscure book. So, which I read. You don't say. So, the reason I bring that book up because it was written by the guy that Newt Gingrich hired to be the essentially House Administrator to implement the Republican Revolution in 1994, the contract with America, do all those internal cleansing of the G stable, so to speak. And he wrote this book afterwards because he was there for 2 years and he was out. Because fundamentally what happened is, when Newt tried to push the system into reform, a guy named Bill Thomas, ever hear him? He was the most powerful congressman from California in the Republican caucus. And he said, Newt, why are we going to dismantle a system that they got the benefit of for 44 years? We've now won. Don't we want to take advantage of these perks too? And actually, when Newt kept pushing, it came to the point where Bill Thomas threatened to expose what was going on in Newt's personal life if he didn't back down. And that lasted 2 years, which is why the Republican Revolution was dead after 2 years. You cannot expect Washington to heal thyself. We have to force change on Washington, and that's why we're taking the approach, and that's why it's different. That's why it's different. Same thing with Nixon's new federalism, Fed Secretary Pros, even Ronald Reagan tried to, but again, he did it from Washington, and you're battling a behemoth that will not reform itself until it is forced to do so from the states, as we're seeing with Obamacare, right? Great question.
Is there a need to repeal the 17th Amendment and get back to state legislators sending our senators to Washington?
You know, there is this, the 17th Amendment obviously had an impact on the ability of the states to be represented in Washington, and that removing that check absolutely is what allowed the expansion of federal power over the 80 years thereafter. But we have to be politically realistic, right? The selling of repealing the 17th Amendment is about essentially taking the right of citizens to vote for their senators away from them. That is likely not a winning battle, right? The philosophical merits aside. So what we have to do is, how do we replace what was structurally the check that the 17th Amendment took away, which was the states who elected senators up until 1913, right? How do we restore that? And I think one way to restore that is, and this is not covered in the report, this is related, is if you want to restore that, we have to potentially put an inject in where, there have been proposals on this, where you have an amendment that allows state legislatures to essentially veto legislation after it's been passed in the House and the Senate, but before the president signs, so you don't have presentment yet. In that interview, you have a 30-day window where state legislatures can pass a resolution, and if 2/3 pass a resolution saying no, it nixes that legislation. That would be the equivalent, right? We want to make sure we don't create too great a check or too little a check, so we've got to nuance it, right? But giving states back the check is how we fix that issue, not trying to repeal an amendment that will be all about taking the rights of people to vote for their elected representatives, which is just, there's no way you win that sound war with the left.
And I think, just a quick dovetail on that, the growth in the federal government that's been all in Washington, all in their bureaucracy, their effectiveness in execution and empowerment across the country, it's all based on the states complying. So typically how they've done that is by bribing the states with money. But what you're starting to see happen now is the states have caught on, and when the states push back, the feds have no way to carry things out. And I bring that up again because when we talk about Medicaid, you're having that conversation in your state right now. Matt mentioned Florida, Arkansas, Michigan, among others that are. One of the things to look at is when your dollar went to the federal government and it came back with that 15 to 35%, what the feds will do when they come back is they don't just write you a check. They come back and they say, we'll give you this, but if you put in X, then we'll give you 2/3. That's how you get your money back. So what they're convincing the state to do and putting the 1/3 in is to make up the federal bureaucracy cost. So you actually just put in $1.30, sometimes up to $1.60 to get your dollar's worth that you started with in the first place, and you just fed a bunch of people in Northern Virginia. I mean, it's basically what happened. And so states are starting to realize, wait a minute, I don't have to comply. My money's not going to this. No, I'm not going to play. And oh, by the way, we're borrowing 40 cents of every dollar we spend at the federal level. This is not Ohio's money that's sitting there, and if you don't take it, it's going to go back. This is China's money. that we're going to go ask for to try to bribe the state. And the more that the states start to figure that out, so the check Matt is talking about, in one way, governors are playing that right now. But in another way, and this, I'm going to dive in on the concept of federalism and why this issue is great. You have people in the state of Ohio that have said that they do not favor the expansion, which has gotten a message to their state representatives, which is then pushed back on their system at their state level and up to their governor, which is then causing another state to push back on the federal government and the president that just created the biggest government program in history and is slowing it down because people and communities in Ohio said no. That is the definition of federalism. It is a beautiful thing, and it's what our founding fathers believed in, and that's exactly what happened in Florida, where you had a governor that kind of waffled on it and then went one way, and the state said no, turned it back, and now a battleground state down there is saying no. Sir, you have a question? You've been waiting. I'm sorry.
Yeah, no, that's all right. I just wanted to ask, as far as Medicaid expansion, and in the spirit of full disclosure, actually, I produced the Joe Riley Morning Show on News Talk 610 WTVN Radio here in Columbus.
Hey, Josh.
Hey, Matt. How you doing?
Good.
We've been in contact with Governor Kasich's office, and we've also, we had an expert on the show this morning, Dr. Gerard Anderson. He is the director of the Center for Hospital Finance and Management at Johns Hopkins Bloomberg School of Public Health. And what we're hearing from both what Dr. Anderson had to say this morning and some of the feedback we're getting from Governor Kasich's office is, if they don't do the Medicaid expansion, not only are hospitals going to lose in the state of Ohio hundreds of millions of dollars, but they will lose their current Medicaid funding. That is what the threat is. And so their argument is, if you think it's bad now, if you think what we are facing via the Affordable Health Care Act now, if we don't do Medicaid expansion, where are we going to make up not just the money we're going to lose if we don't do it, but the current funding we're getting from Washington now? And so I would just be curious, just to get you gentlemen's perspective on where you could make up that gap in funding, and if maybe those are just veiled, hollow threats, if that's just the talking point they're using.
Yeah, veiled, hollow threats, and I'll give you the Oklahoma example, and then I'll tie back into why it's a hollow threat. In Oklahoma, what they're saying right now is, well, if we don't expand Medicaid, 1/3 of all hospitals, rural hospitals, are going to shut their doors, that they're going to go bankrupt tomorrow. And that, I would say, highlights a question about how we're administering healthcare and how the hospitals have set up their business in the first place. But this is why it's empty. The Obama budget that was just submitted, and I bring their budget up, not the others, they have put the dish payments, the money for the dish payments, back in for the next year. So if you don't expand anything at all, the hospitals are still going to operate as they do for the next year, now per that budget. And that's not the Ryan plan that's trying to figure out a different method. That's the Obama White House. And so if every state tomorrow said no, now the reason that they did that is because they're trying to buy time. HHS is sending out emails saying, cut deals, figure something out. The Obamacare structure is crumbling. We've got to figure something out. And so the idea that your hospitals in Ohio will starve tomorrow if you don't take more federal money from China for a program that doesn't exist is A, just patently false. I mean, it's factually not accurate. But two, this is part of the conversation that gets into on Medicaid, on the expansion. Does the federal government have the money in the first place? And we find out that the White House, their deficit reduction plan, the Gang of Six plan that was submitted about 18 months ago, and then the plan that's sitting in the Congress right now that Paul Ryan and Cantor and those guys put together, every single one of them has the federal government not meeting that 100% funding for 3 years promise. Every deficit reduction plan. So while they're telling you right now, oh, it's this money and this pot of gold and we need to go after it, at the same time, they're already making sure the hospitals are covered to work things out. And then number two, they're already saying, we're not going to give them suckers. We'll get you sucked in for a year and then you're on your own. And so I think those are some things to consider. Matt, you know more about Ohio specifically, but that's that stuff that's really going on outside of the talking points.
Yeah, Josh, that is just an emotional blackmail threat that is empty. I mean, I would absolutely love the Obama administration to say, well, Ohio, you didn't do it, so we're going to take our marbles and go home. We're going to penalize the poor in Ohio by taking funds away from the existing program. That just isn't on the table realistically in any politically viable way. It just isn't, right? I mean, the reality is that it would be nice if instead of the governor throwing out these types of the sky is falling, he stood up with the voice of a governor and said, if they dare try to touch our existing funding, we are going to make so many problems for them judicially in the legal system. We're going to give them a PR war they never even imagined, instead of just saying, oh yeah, it's going to happen. I mean, it's just blackmail to try to get an end that is not good for the people in the system. It's not good for taxpayers in the long term, either federally or in Ohio. And I would just say, Jason, stand up for a second. Jason Hart, if you don't know Jason, you should know Jason. Media Trackers Ohio, if you don't follow Media Trackers Ohio, you should. Jason and his cohort Jesse have done enormous amounts of work exposing the lie from the hospital associations that is the we're going to go broke if we don't get this money. The reality is, if you look at their 990 as Jason has, you will find out that they made money in the previous years well above what their costs were. They're increasing CEO pay. They're building additions. All these things that if they are on the edge of bankruptcy, they certainly wouldn't be doing. And more importantly, when they throw out numbers for uncompensated care, it is a made-up fictional number. The uncompensated care number is the book value that nobody in the world actually ever pays. And if they say it's $5 million, the reality is it's under $1 million when you say, well, what do they really pay in Medicare? What does private insurance pay? What does Medicaid pay? Right? They just make this number up. But even after paying the uncompensated care, they're still profitable as for-profits, by the way. They're still expanding. I don't know if you've driven up at 315, but there's a huge expansion going on at Ohio State. There's an expansion at Grant. There's an expansion at Nationwide Children's. All these hospitals that are crime poverty are expanding at a rate that's unprecedented all over Ohio, by the way. And so, again, just more veiled threats to try to scare people when what they should be doing is saying, how can we get back full authority in our money that we send to Washington for Medicaid so that we can design a system that gets good outcomes for the recipients on it at a price taxpayers can afford today and into the future.
You know, and one other last thing I'll throw in before we jump to the other question. In the state of Florida, again, talking about competitive federalism, you had two communities. One was Miami-Dade County and the other was the city of Tampa that addressed this problem in the last 18 months by having voter-approved sales tax measures, a penny sales tax. And what that sales tax does, in the county, it goes directly to the county hospital. The money just goes directly to them so that anybody in the county that would fit under that poverty line of what they've established can go in and get care, and the money's paid for. And they're not beholden to the state or the federal government. In Tampa, that penny goes basically to create a local insurance program that balances out, that works with private insurers, so that someone that comes in with a need, they can. So the local community and the people in the community said, no. We don't want to go bankrupt with the country. We don't want to have to do something the way somebody else tells us. We're going to solve the problem here and take care of our own. Here's how we're going to do it, and we do so in a way that doesn't damage our economy. And so the solutions are there when you empower the people locally to do it without sticking your hand out to the feds.
Yeah, Josh, after Florida rejected Medicaid expansion under Governor Scott's proposal, they're now considering legislation that is a purely state-based play that is not expanding Medicaid or taking federal dollars to essentially help fix their Medicaid system even better than they've already done in the state of Florida. And we're going to have a piece come out over the next few months from Opportunity Ohio in partnership. We're going to have an similar Ohio recommendation plan that comes out to say, look, we want to do this right. Here's how you do it.
Essentially taking care of it themselves and not being beholden to the teat of Washington.
That's exactly right.
Couldn't have said it better.
My name is Mark Beambridge, and my background, a CPA, and my background is with healthcare finance. And I would just echo what Matt said, is that these calculations of uncompensated care are done at their revenues, their charge rate, which nobody pays. Insurance companies typically pay 40% of that, at most. Now, the other point I want to make on the Medicaid thing is they're crying, the Ohio Hospital Association is crying for more money. But if you look at the reality, even their own data says that the cost of providing the services for Medicaid is higher than what they're receiving from Medicaid. So if those hospitals are using their heads, they don't want Medicaid because they are losing money on that, and all of us are subsidizing that.
Isn't it interesting that all the conversation and when the Affordable Care Act was going through, got to reform the health system and everything, well, have you ever noticed how much a BandAid costs you when you go to the hospital, and, you know, the inflation costs you everything, and yet here we are with this new reform, and what is it about? Increased cost, and more money that you'll have to take, and more money that the state will have to put in, and more money that has to be taxed out of job creators.
Yeah, look, you don't actually have to believe a word that Michael or I say. Chris is up there, sorry, Chris. A word we say. Take the guy who's the executive director of the National Association of State Medicaid Directors. And what he said is, where we've expanded Medicaid in the past, we've learned two lessons. More people show up than we estimate, and they cost more than we estimate. So you don't have to actually believe a word I say or anybody else who says who opposes Medicaid expansion. What we know is if we expand Medicaid in Ohio in any form or fashion, it will involve more people than you realize, and it will cost more than they say. And as a result, that means not federal tax dollars, folks, state tax dollars.
I hope, and I'm sure everybody here hopes, that the fire starts, sweeps across the nation, and then we have enough people who understand that we need a different model of federalism than the one that has evolved. The question is, what is the vehicle? We saw a little uprising on Real ID. Now we got a major opportunity here with Obamacare. I think we're going to win the fight on exchanges. I don't know what's going to happen about the Medicaid expansion we're talking about now, but what's the long-term vehicle here? Is it can we recapture the 10th Amendment somehow? Do we need the Madison Amendment? Is it going to be the nullification some people are talking about? What do we do long-term?
Well, and that's part of the beauty in competitive federalism is that it's not just one vehicle that everyone has to be part of. It's a multiple play. And so, you know, you have, what, 30 Republican governors right now, and is it 24, 27 states where it's a complete, so your state government looks exactly opposite from the federal government that started creating all of this a few years ago. And so that is that kind of federalism in action element. So what I would suggest is, you're going to see, as we do right now, bubbling up balanced budget amendments, Article 5 convention conversations, con. In fact, I think there's 11 states right now considering nullification on different items. I think you have a measure here in Ohio on the Real ID Act, and a couple other states have them on health care. You're going to continue to see that bubble, but the point is, federalism, realizing federalism, is not just one idea that we all sign on to all of a sudden transform the federal government, but it's wrestling that decision to where the feds are not saying, okay, the 10th Amendment, we're going to let you have this and realize it. It's the state saying, no, per the 10th Amendment, this is how it's going to play, and this is what we're going to do. And imagine now, to carry your thought out a step further, because I think it's a great point, imagine if we have states respond to education policy the same exact way they're responding to healthcare policy right now. No. I don't think we're going to implement that No Child Left Behind or Race to the Top. I think we're going to do it this way in our state. No, I don't think we're going to implement that data tracking system for all of our kids. That's not how we're going to do it in the state of Ohio or Oklahoma. And all of a sudden, that federal policy starts to break apart. And that is how you're going to get to this condition where we realize, as you said, the true meaning of federalism, rather than just trying to have one thing that pushes and breaks Washington. I think the fact that they're philosophically and financially bankrupt right now is going to break them. And I used this morning with the lawmakers. Federalism is the one eye in the land of the blind, and as the Bible tells us, that man is king. And so as we start realizing this and carrying it out, I think the pressures that be, and by pushing, that's how we're going to get to the point we want to get at. I don't know if you...
Yeah, I mean, just look, ultimately, they can only do what they're doing as long as somebody's buying our bonds. But there's going to come a point, right, where they're going to stop buying our bonds. And at that point, they're not going to keep doing this deficit, paper printing money exercise that's going to create huge inflation at some point. Don't know when. People like Mike Sullivan are much smarter than I am to figure out when that's going to happen. I hope, and if he is, I need to make sure I invest in him. But the reality is, we don't need to get the whole enchilada. You know, I took Latin in high school, and it was during the fall of the Soviet Union and the Berlin Wall. And I remember one day sitting in class, you know, somebody asked a question about, you know, glasnost and perestroika and what's going to happen. And my Latin teacher said, well, it's a lot like Pandora's box. in the opposite way. Once you take the lid off of freedom and people taste just a little bit of it, they're going to want more of it. And once that lid's off, you're never getting freedom back into the bottle. And that's what exactly we saw happen right over the course of the next several years as freedom spread everywhere in what was formerly the Iron Curtain. And I think with federalism, if we can get this national grassroots uprising that demands congressional delegation to pass model legislation, pass one piece, give us full authority and money over Medicaid, give it to us on education, and let's see the laboratories of competition do what they do best. Once they taste and see what great things can happen, how we can get more money into the healthcare provider that gets better outcomes at a lower cost, we're going to want that on every other issue that we see, because that tasting success, people are going to want more of it. And I think that's how this is going to spread in that kind of viral sense of, we do it once, and we free the states to act, they're going to want to act more. And again, it doesn't matter if it's a Democrat or Republican. Democrat governors want just as much money and power over their states as Republican governors, same with legislatures. So this is a bipartisan play. That means, you know, Cuomo's going to want the same kind of authority that John Kasich's going to want. Well, let's give it to him. And let's have the states come up with the best and brightest, and we'll figure out who's better and come up with better policies for their states that work better, get better results at a lower cost. Bill. Oh, okay. It's on.
Michael, thanks for making the trip out. Absolutely appreciate your comments. Matt, thanks for hosting. I guess I have two questions. One is, you know, free markets presume the ready availability of informed information or accurate information, sharing of data that has credibility. Besides SPN, PolicyBot, other existing infrastructures for distribution of innovative ideas or best practices state by state by state, do you feel there has to be additional architecture, first off, to provide you know, true blue data that we can go to the bank on? Because I think that is going to be a huge factor. How legit are the actual results from these innovative practices? So I'd love for you maybe to comment a little bit to all of us on that, and who you're looking to and or trusting. And then second, I'd just be curious if Matt in particular, if you'd be willing to throw a forensic up on how Kasich got it so wrong in terms of a senior policy surround team. In your opinion, how do we fail to inform, upload, and otherwise brief in a way that we got a really wrong sway from an otherwise fairly free market in tune government?
Well, Matt is thinking deeply.
Boy, you really want me to get surpass Chris as #1 on the enemies list, don't you?
You know, let me give a little bit of an analogy to this that might help. Just weigh in. When Governor Fallon first took office in Oklahoma, the exchange question came up. Her first reaction was, "Oh yeah, we're going to do it, but we'll do it our way in Oklahoma." And the Tea Party at that time in Oklahoma was pushing back pretty strong, having rallies. And she actually said publicly, they're just not informed on the subject. And now, right, then she rejected $54 million grant, and then now is refusing and moved forward. Apparently she wasn't as informed. But what happened there is this. This is my analogy, my point. Governor Fallon has been in office for almost 3 decades. Spent a good portion of time in Congress, and her staff mostly came from Congress. They spent over a decade working in the federal bureaucracy. To them, to a lot of folks that a lot of our governors have on their staff, a lot of leadership, the prism is government. This is how it works. You just do it your way. And so a lot of times their first reaction is going to be, well, okay, this is how the thing goes, and I'll just try to get it and do it myself. Until we really dive in and force it. That's their knee-jerk reaction. Just like our reaction is usually, well, if the government's doing it, it's probably going to be wrong. And it's probably going to cost me a lot, right? That they have a reaction to. That's what we saw in Oklahoma, and had to bring the information forward to create that distro channel. And the other short answer, excuse me, I told you the hand thing was going to cause us trouble, is that actually Liberty Foundation, one of the projects that we're actually formed for and we're into right now is the data mining and the data distribution channel. But here's the difference, because you're all reading the same thing we are, right? Karl Rove, Crossroads, Coke Network, everyone and their dog is data. We got to do data. But they're doing data for elections. so that they're going to use it in place to try to get in front of you every 2 or 4 years to tell you to vote for it. What we're looking to do is say, we'll take that data and let's energize the grassroots and do a better job of activating and informing the people that need to be in the public policy conversations, so that at the state level, we can realize the reforms we need to. Not just, how do we activate this person to get Tom elected? And then Tom gets in there and he puts people around him that worked in government, and then we're fighting ourselves again.
Yeah, so on the infrastructure, you know, if you haven't read the What Happened in Ohio piece I did after the election, that part 7 really spells out what I think needs to be the case. We need to have an infrastructure. We need Jason times 10, so that there's 10 Jasons doing Ohio Media Trackers, Media Trackers Ohio. We need to create that altered network. We need to get more and more people aware of Jason and what Jason does, so that they get that news that the dispatch, which, you know, has now gone fully into the tank for Medicaid expansion and severance tax and all these bad policies. They're not reporting this stuff. You know, you don't read in the dispatch about the 3,700 net jobs in the private sector in the last 8 months, no, 9 months. Right? You haven't read anything like that. Why not? Well, we need to make sure Ohioans are getting educated on these issues, because it's the only way they can make those informed decisions, right? So we need bigger distribution for folks to get the information. We need somebody to develop that alternative news that the mainstream media is just not going to do a good job of doing, or they're not going to publish. And then we need that action side, the Ohio Rising, that's going to go out there and get the accountability for this stuff. On the governor, you know, look, I can't do seances and figure out what's on his mind. But somebody said this to me, and I think it made sense. He has an inherent legislator Washington orientation. Right? The bulk of his career, and the best part of his career, was as the budget guy for New before and after the revolution, where he either created these budgets, right, that were the shadow budgets, or the budgets. And it was, here it is, do it, right? And so I think he has an inherent DC where he gets this, oh yeah, if you give us some money, we'll do this, and that's the way the world works, and we're, you know, we shake hands and move on, and we'll do it. So I think that there's an orientation that sounds right to me, which is how he approaches problems. It's how he approaches the legislature. Very little collaboration with the House and Senate members. Drops stuff on their lap and says, do it. Because that's what he was used to doing as the House budget guy, right? Hey, I've done this, I was charged with doing it, here it is, do it. So that's piece number 1. You know, there's obviously with Medicaid, I think that there's this interest to try to appeal into this middle, to try to pick up re-election votes or presidential votes. I'm not sure exactly what they were thinking. I think they underestimated the base's opposition to this. And one lesson from November that's pretty clear is, if the base doesn't show up, I don't care how many middle people you get for you, you're not winning. And so I think he really has to figure out how to repair the base issue. And I know that right now Quinnipiac has him at 52, 53. He looks good on those numbers, which is fine, but looking good versus people voting on an election are going to be very different outcomes. You know, the third piece is, it's just Machiavellian, right? Medicaid expansion would have allowed him to take federal funds and cut state dollars to hospitals, replace those funds with federal funds, and use those state dollars to fund a tax cut, which is what he wants to do, right? So it's very much a Machiavellian approach to, well, they take their money, I can cut my state side of it and use that money for a tax cut. And I think that's what really drove some of the decision making. So it was very political rather than good policy. I mean, that's kind of my polite way of answering. Last question, and I know we can get you guys back to your businesses. Bill.
Going back a few steps to the whole concept of, you know, competitive states and where the money comes from. I mean, you're talking to a room that is probably a fairly fiscally conservative group, so it's an easy sell. What I'm trying to understand is sort of the human nature, human behavior that you guys are coming in contact. Do people who are administering these programs, let's say on a state level, let's say for any one of the things you mentioned, healthcare, education, you name it, did they realize that we're on a course for a train wreck? I mean, you know, when people stop lending us money, it's not just going to be some passive event, right? I mean, that's pretty calamitous, and all their programs are at risk. Did they see that? Did they see that they need these kind of reforms to continue to provide what they consider essential services?
I think you have the condition of a static view of the world versus dynamic. When you mentioned fiscal conservatives a second ago, a lot of us understand the concept, Economics 101, that if I don't take his money and he has it, he's going to go spend it and there's going to be growth out of it. But it's surprising how many of these groups that are part of these programs that think any net loss today, if you change the status quo, I lose. And the only change to the status quo I like is when I grow what I have today and don't understand how anything else works. So you're right, they fight. But a sub-point to the first part of your question is, if you look at the list of states that are involved that we're getting ready to go meet with, a lot of those are states where we're going to be meeting with Democrat governors. We're going to be meeting with lawmakers that if we sat down and talked about what's your thought on Medicaid, we're not going to agree on the policy. But what they like is, I could have more control and I could do it more my way here. Jerry Brown could create his cabal as he likes, as Matt pointed out. And so that is an element to this that I think when we get in contact with some folks that they start to get and they start to understand. But I think you're right. I mean, there is a point where, especially in the policy-making process, and this goes for even on the right, that you have lobbyists or you have entrenched interests that they're just there, right, to have their piece, to do it their way, but to have their piece, and they kind of push back at it. You know more about Ohio.
No. I think it's we talk about this in the report, Bill, because it's a very good question, right? And I think beyond do they realize the fiscal house is going to collapse? More importantly, I think our conversation with them is a very different conversation, actually. It's do you realize by doing what we propose, cutting Washington taxes, state taxes going up, getting rid of that 15 to 35 cents programmatically of waste, fraud, abuse, and bureaucracy, we're actually going to get more money into the healthcare providers, more money into the classrooms, more money into our transportation system at a lower taxpayer cost. And because we're going to be able to design things here, we're going to be able to control outcomes far better than some bureaucrat in Washington. So any progressive, liberal, do-gooder healthcare Medicaid provider, right, who like, oh, the system you guys are just taking money from the poor, they're actually going to benefit from this system. That's a intentional design of our program, is because our view is, right, this is not a fiscally conservative or liberal progressive pitch. It's a, where do you want power to be, and do you want to control outcomes and have more money at a lower cost to get those kinds of outcomes? And I think if the answer is yes to those questions, which for most Americans it is yes, that's how we ultimately win the broader battle. But this is a generational conversation. This is not by 2016 we're going to have won this bad boy. I mean, that is not, we're on a long play on this issue, and that's why we talk about that infrastructure and the data mining. That is all going to be wrapped around all of this to help start pushing these issues in key states and key places, because we know once people are educated, they make wonderful decisions.
A few closing comments, if I could, because I think the sound of God is telling us that you all have to get back to work because somebody has to pay for all of this government activity. But two thoughts. One, last touch for you. Just so you know, in addition to these other states that we're going to, later on this week, Matt and I will be in Florida presenting in front of the State Policy Network to a lot of our colleagues, and then presenting at the Heritage Foundation's Resource Bank. And Heritage is a great partner, and Matt is a fellow with them. I think we have sort of a Heritage Action that's here that helps out quite a bit. So we're excited about that conversation. But here's my closing thought for you. It's two quotes that I want you to remember. The first, Ronald Reagan, on his inauguration in January 1981, he said, "We all should remember and be reminded that the states created the federal government. The federal government did not create the states." And second of all, Abraham Lincoln said before he died, "Let no feeling of discouragement prey upon you, and in the end you are sure to succeed." We are on the right path, the righteous path. I thank you all for being here. Let's go save it. And register for the next event in 2 weeks on getting Ohio competitive economically.